My name is Carly Lagasse, and I'm going to be demonstrating how to give a cat its insulin shot. This relates to anyone who owns a diabetic cat or dog, anyone who works or cares for animals, or just anyone who has an interest in knowing how to give an animal their shot. Gato, my cat, has been diabetic for 1 year, and Chloe, my dog, has been diabetic for 6 months. They both get 2 shots a day, once in the morning and once at night. If your animal is diabetic, it just means that their blood glucose cannot be normalized, the pancreas cannot regulate blood sugar, and the insulin just helps the body break down the glucose so it can be used. Signs of diabetes are weight loss, increased water consumption, increased urination, and loss of appetite. So when you're first going to do the shot, you want to make sure you wash your hands for at least 20 seconds to get all the germs and bacteria off. For the insulin and syringes, this is the insulin, this is the syringe. You always keep the insulin in the refrigerator and the syringes in a safe place. And you always want to use a new syringe. So the insulin comes in a glass bottle like this with a rubber stopper at the top. The insulin is a suspension, so you want to make sure that you mix it up. So what I usually do is I rub it in between my hands to warm it up, and then I just turn it a few times. You don't want to shake it because that will create air bubbles. So just turn it and mix up the molecules. So administering that insulin. So you pull the cap off of the plunger end, and then you want to pull the cap off of the needle. And then Gato gets 8 units of insulin, so you'll pull it back until it gets to 8 units. And then you'll get your insulin, turn it upside down, and you want to push that air back into the bottle to make sure that there's no air bubbles in it. And then you'll pull back on the plunger, and you'll go to 10 units, and that's just to be sure that there's no bubbles in there. And if there is, just flick it a couple times. That usually gets rid of it. If it doesn't, you can just start over and do it again. And then you'll push it back up to 8. Take the needle out, put the cap back on the needle, and be careful because it's sharp. I usually let Gato smell the insulin just a little bit, just so he knows what it is and what's kind of going on. You put the insulin shot in the neck, the lower stomach, or in the thigh area. The needle is small, and so it won't hurt them. And then we're going to be giving Gato his shot in the scruff of his neck. So what you do is you take your index finger and your thumb, you pinch up his neck, and then make sure you move any hair so you can see. Take the cap off. You can either take it off with your teeth or have someone else do it. And then you're going to put the needle at a 45-degree angle. Sometimes he likes to move around. So put it in at a 45-degree angle and just push it in there. And then with your index finger, push down on the plunger. And then put the cap back on the needle, and just tell him that he did a good job. Pet him a little bit so he knows that you're done and he did a good job. And make sure you dispose of the needle immediately and put the insulin back in the refrigerator. And then it's important to give the shot in a different place each time because the scar tissue will start to develop and it won't be able to absorb the insulin as easily. And then that is how you give a cat his insulin shot.